today's very important lecture talking about MRCGP International OSCE CSA exam. My name is Dr. Mahmoud Al-Ammari. I'm a provider of one-shot MRCGP courses for MRCGP OSCE exam. And I finished the MRCGP International in 2018 at one shot, both part one and part two, hence the name of the course, one shot course. I'm here to help you to pass this exam in one shot, the same as I do, the same as many other colleagues who did the same as well. I will go through this lecture into many objectives, many things we will discuss in this lecture. First, the exam eligibility, exam format, and how the exam is marked, and how to prepare for this exam, and why this exam has bad reputation about people failing in the exam despite they are perfect in knowledge, they are competent in knowledge, yet they could not clear the exam. Why this exam has this bad reputation, and how one shot helps in OSCE CSE exam preparation, and brief information about the course fees and how to apply for the OSCE exam, and how much time needed for OSCE exam preparation. And finally, I will open the floor for questions and answers at the end. This is your target. You are one step apart from achieving your target. The target is this beautiful certificate, inshallah. One day your name will be right here. And the more beautiful than the certificate is the pin right here. I hope they are still given this pin along with the certificate. Is very beautiful pin, and I will always make it a fun with my colleagues that the pin is more important than the certificate. You should never give up the pin. It's not clear here, but it's written like RCGP. They are giving it as a souvenir with the certificate. So hopefully, inshallah, you will receive your pin and the certificate with it as well. Speaking about exam eligibility, we have three centers here. We will discuss the centers that accept candidates without training. I believe all of you are applicants for either of the three centers. The first center we'll talk about is Dubai. Dubai center, you don't have to start with AKT. You don't have to pass AKT first. You can start with CCSA exam. If you don't have any previous exams passed, all what you need is the eligibility requirement of Dubai MRCGP exam overall. It should apply to you. We will not go through them in details. I believe most of you know, all of you know it who applied for Dubai. But you need CPR certificate or BLS certificate, valid one. And as for the Dubai AKT exam, the AKT exam and the SEQ, the exam, the other two exams, in case you passed any of them, the AKT or MEQ, sorry, not SEQ, it's called MEQ. If you pass any of those, you have to pass the CCSA within 3 years from the date of passing either of them. So you have two scenarios here. Either you will start with the CCSA exam, you can start with it. You don't have to do the AKT first or MEQ first. You can start with it, and those are the requirements. But in case you started with AKT or MEQ, you have only 3 years from date of passing in order to finish the CCSA exam. Okay, what if 3 years passed without finishing the CCSA exam after AKT or MEQ? You will have to do again the AKT or MEQ all over again. As for South Asia, the requirement is to pass AKT exam. This is a mandatory requirement for the OSCE exam. And in case AKT is attempt with partial experience, like I think 18 months, some of you have passed the AKT or the eligibility for AKT for them was called partial eligibility of 18-month experience as GP. They can go through AKT, but they are not allowed to go through OSCE until completing the eligibility of OSCE exam. But in case from the beginning you applied, you were eligible for both AKT and OSCE, then you can do the OSCE immediately. And once you pass the AKT, you have only 6 years from the date of AKT exam. The date of AKT exam, like for example, it was a May 2020, then you have up to May 2026 to pass the OSCE. What if you did not pass the OSCE until May 2026? You'll have to repeat AKT again. If OSCE was attempted before, like after AKT, one have tried to go through OSCE but did not pass, he has 2 unsuccessful attempts. The third one, he should either pass or repeat the AKT again. So you have 2 unsuccessful attempts, try a chance to finish within 6 years. The third one, either to pass and get the certificate, or if you unsuccessful, that's 3 times, you have to repeat the AKT exam again. As for Cyprus, the eligibility requirement is enrollment in Nicosia Family Medicine Online Diploma or Master, and passing the AKT exam and passing first part of Diploma of Family Medicine of Nicosia. As for the exam format, it's very much similar in all the 3 centers, Dubai, South Asia, and Cyprus. Very minor differences. It's about 14 stations of 14 patients. Those patients are not real patients. They are patients who are actors, who are pretending to be patients. So you are not expecting to find any physical findings in those patients. Each station is 10 minutes each. In this 10 minutes, you are required to do full history, examination, and management for the patient, the same as your daily clinic. You have, along with those 14 stations, you have 5 extra break stations in South Asia. Each one is 10 minutes each, and they are scattered in between those 14 stations. Like you have 3 stations and then 1 break, 4 stations, 1 break, and so on. And as for Dubai, there are 7 stations and then 1 break station and then 7 stations. So they are very much less break stations in Dubai. As for Cyprus, no break, but the exam itself is on 3 days. First day, 5 cases, second day, 5 cases, third day, 4 cases. But in Dubai and South Asia, it's 1 day exam. 1 day exam. So, for example, South Asia, you may find in the calendar, just the connection is unstable. In the calendar in South Asia, you may find the exam is 5 days. Those are actually 5, we can say 5 windows of days, but you will examine in only one of them. So your exam will be 1 day only, and another colleague will be in another day, another colleague will be in another day, because they cannot afford to take all the candidates in 1 day, so they distributed them in 5 days or 3 days. But however, it's your exam will be only 1 day in South Asia. You between each station and another, you have 1.5 minutes between each station and another, and you are the one outside the room in case of South Asia. So the patient inside a room, and you are getting into the room, talking to the patient, finishing your 10 minutes, getting out, and waiting 1.5 minutes, looking at the paper outside the room, and then get into the next one, and so on. But in Dubai, the patient is the one coming to you. You are staying in your room, you are not leaving anywhere. The patient and the examiner are the one coming into your room, and after 10 minutes they are getting out and another patient come, and so on. Telephones and smart gadgets are not allowed, and you can't hear the next station, but you can hear the previous station. Like for example, because it's not a big place, so there are 14 rooms, so you may expect to hear some of the conversations inside the room, but usually the conversation is in the station that you have left it already, but not in the next station. Don't think that you can listen to the next station so that you can know what's the diagnosis. You will never be able to do that. They are testing the noise before starting the exam, so they are making sure that you will not be able to hear the next station, but the previous station you can hear it. But this is the bad news, by the way, because hearing the previous station can make you remember things that you have forgotten. So the very good reason for anxiety. You say, he asked about smoking, I didn't ask about, I forget this, I forgot this. So it's very important to try not to listen. Just forget about it. What happened is what happened in the previous station. Before each station, there is a paper. The same paper is present inside the room. You have 1.5 minutes to read. In this paper, there are just brief information about what's required from you. Some cases like, for example, Mr. Ahmed is 45 years old, come to discuss his health. You need to do history and examination and management. Like this. This is just brief paper. And once you come in, you will find the same paper inside, so that in case you forgot the name of the patient, for example, you can look at this paper. There are covered papers. You are not allowed to see. those papers contain findings, either investigation or examination findings, they will not open it to you until you ask for it. Like, for example, a case of hypothyroidism, you will not, if you ask for TSH, they can uncover this paper if there is a TSH finding. But if you didn't say, I want to do TSH, they will not open it for you. The same like for examination finding. If you ask to do examination, they will show you this paper. If you didn't ask to do the examination, they will not show it for you. In Cyprus, there is one telephone consultation. They are put in a curtain and you cannot see the patient, but you are talking to him on the phone. This in Cyprus and also MRCGP UK, but it's not in South Asia or Dubai version. Exam is English speaking in all the three centers, Dubai, South Asia, and Cyprus. Next is the target station structure as regards the exam format. The exam format is 10 minutes, composed of three parts: data gathering, which is the history taking, examination, and management. Management is the most important part, the ending of the case, and you should divide your time, the 10 minutes, to be equally to those three. Many colleagues waste much time in history taken on the expense of examination and management. So you have to finish your data gathering in 3.5 minutes, examination maximum 3 minutes, management should be until the whistle, of course, until the end of the 10 minutes. So you should start it early so that you can have 3.5 minutes at least to finish the important aspects of the management. And by the way, the case start with a whistle and end with a whistle. The target station structure, if the examination is not required, which is in some cases, they are clearly stating in South Asia that examination is not required. At this point, you have more time to spend in data gathering, but shouldn't be more than 5 minutes. And the rest should be for the management. This is called counseling cases in which there is no examination. And as regards the exam time management, it's more difficult in South Asia than Cyprus, than Dubai. This is because in Cyprus and Dubai, they are not asking you to perform the examination. What's meaning of perform the examination? To do the steps, to listen, to auscultate the chest, to percuss the chest, to palpate the abdomen. This is required in South Asia. They are expecting for you to do it and they are evaluating for you to do it. But in Cyprus and Dubai, they are only expecting that you will say, I want to examine the chest, I want to listen to the chest, I want to listen to the heart, I want to touch your legs, and that's it. Once you say this, they will show you a paper. They will not ask you to perform what you ask to do. So it's more time saving as for Cyprus and Dubai. But as for South Asia, it's difficult time management because the performance definitely consume time. First of all, the data gathering, as you all know, as we all take in the undergraduate, we know the history taken, we all know the steps of history taken. But in this exam, you will learn it in a different way. You will learn it, perhaps this is the first time you ever perform the history taken to be focused history taken. The history taken items, as you all know, history of present illness, past medical history, and question about differential diagnosis. We all know about this, but there are some things that we need to know in family medicine, like red flags, things that warrant further intervention or further investigation or urgent referral or even admission. Those are called red flags. Each case has red flags that you need to rule them out. Also, gynecological and obstetric history in females, and sexual history only if indicated, and drug history and allergy, and family history, and psychosocial history. Also, some of you may find this as new to them, this term. Psychosocial has elements that we can say it simply, the environment of this patient life, the environment, the background of patient life, how much it's impacted by this condition, either as a cause or as effect. Let me explain it simply that, for example, smoking can cause COPD. So it's a cause. Smoking is a cause. And as effect, for example, someone has dizziness, it can affect driving. So here, thinking about the psychosocial elements, either as a cause or as effect. The psychosocial elements are smoking, alcohol, illicit drugs, the narcotics, the illegal drugs, diet, exercise, driving, and home and work. So you need to ask about relevant issues regarding the psychosocial history. You will not ask about all of them in all patients. You will ask only if they are relevant. And then also a new term, maybe new to most of you, which is the IC. IC is idea, concern, expectation, and impact. Idea, what's the patient think about their illness? You need to explore that because he might have wrong idea. He need to clarify, you need to correct it. Concern, the idea could be worrying and could be different than the concern. The patient could have idea, but he has extra concern. So you need to explore it. Expectation, what the patient wants in this consultation. Do not assume that the patient definitely wants medication. He could simply want MRI, not necessarily to be a medicine, could be investigation. And impact, how this condition affect the patient life. So this is mandatory to be asked in all cases. And finally, summarizing the data gathering. This should be covered in patients, but not all patients you will get through all these items. So this is a challenging part in OSCE exam of MRCGP International. They are expecting you to do focused examination. Focused mean that it fits each case. If it's not relevant, do not ask it. Like one example here, like the psychosocial history. If smoking is not relevant to the case, do not ask it. For example, like a case, let's give, for example, alopecia. Patient with alopecia, don't ask him about smoking because smoking is not relevant. Does smoking cause alopecia? So if it's not relevant, do not ask it, and so on. And also one more thing regarding the scheme questions. Scheme questions is things that can help you to question or ask about history of present illness. These scheme questions are provided in the course, that's why it's written here, but it's not mandatory to use scheme questions. You can use anything regarding the analysis of the complaint or history of present illness. By the way, also, even history of present illness should be focused. You cannot just do full system inquiry because you have 10 minutes to finish the whole case. So if you will do all these without selection, without selecting, without being focused, you will finish hardly the whole history in 10 minutes. Only the history will take 10 minutes. But if you make it focused, we could think that it's logical to be less than a third of the time, or at least third of the time of the case, like we discussed earlier, to be not more than 3.5 minutes. Out of those important items or data gathering items, the red ones are mandatory to be asked in all cases. So you may skip the whole past medical history if it's not relevant. You may skip the sexual history. You may skip family history, but those items, present illness, differential diagnosis, at least one question, red flags, last menstrual history in females and contraception, drug history, psychosocial history, the relevant one, IC, and summary, they should be asked in all cases. Of course, differential diagnosis, except counseling cases, in case the patient is non-diagnosis coming to discuss his health, you don't have to ask about differential diagnosis. The next one is the examination in the consultation skeleton. The examination, especially I'm talking about South Asia, is focused examination. So also we are dealing here with examination, clinical examination, different than we used to in the undergraduate. In undergraduate, we used to take the examination of neurological examination, for example, in 15 minutes, abdominal examination in 10 minutes, cardiovascular examination in 10 minutes. Now you are required to do this particular examination in only 3 minutes or even less, sometimes even less. So it has to be focused. And this focused examination, focused chest or abdomen or CVS or CNS or musculoskeletal, knee, shoulder, elbow, wrist, back, foot, neck, thyroid gland, all this you have to know how to do them as focused examination. In this examination in MRCGP International, the per vaginal or per rectal examination not required, but you may ask to do it. Like you say, I want to do per rectal examination, they will not let you to do this maneuver in the exam, but they may give you a finding. Also, otoscopy, you will not do it in the exam. Fundoscopy, you will not do it in the exam, but they may give you a photo. So you may ask to do it. They may give you a photo or a paper finding, but you will not actually do it, unlike the previous ones. The examiner will not discuss anything with you. So unlike other exams like MRCP may have a discussion at the end, here he will not discuss anything. He will not comment whether you did well or you didn't do well. He will just observe with mask face and watch you carefully what you are doing, and you are not required to justify. You are not required to justify why you did the steps. So you are talking to a patient, okay? You are talking to the patient. Ignore the examiner. Consider that the examiner does not exist. And just 1 minute, I will disable the okay. The examiner, consider that he does not exist. You will talk to the patient. So when you talk to a patient, you will say, I want to listen to your chest. You will not say, I want to auscultate, I want to percuss. You will say, I will listen to your chest, I will tap on your chest. And you will not say, I will look for at your eye, looking for edema or pallor or jaundice or cyanosis. You don't have to justify, because in the actual life, you are not justifying to the patient medical terms that need 30 minutes to explain what's jaundice, what's pallor, what's cyanosis. So nobody actually justify each step why he did it for the patient. We are not doing this in our clinic. We are just explaining and taking consent. What we are doing only, I will do and take just a minor consent. Now, can I touch your tummy? Can I take a look at your tongue? Can you open your mouth? Can you look up? Can you open your eye? And so on. This is consent, a minor consent, like before the step, just to explain what you'll do. And you will not justify why you will do it, neither to the patient nor to the examiner. The examiner will not talk to you, will not tell you why you look at the patient eye. He will never say this to you in MRCGP exam. At the end of examination, you may receive findings, either verbal or written, or not receive anything at all. So don't be surprised that you start to do examination, and after the examination, no paper is given to you. This does not mean that you did it wrong. Just consider that is normal, and that's it. In my exam, I never received an examination finding. I passed, alhamdulillah, and I have around 5 or 6 stations with examination. I didn't receive any finding. And some examinations, you are guided by the patient pain. For example, like musculoskeletal, most of the musculoskeletal, when you do the examination movement, particular movement, the patient will act as he's in pain. Yes, it's painful, doctor. So that's enough. No need to receive a paper of painful abduction. You already interpreted when you start to do the abduction, the patient show you pain. So sometimes you don't need to receive a paper at all. And sometimes you are expecting a paper, expecting to find it, but the examiner just don't give you anything, don't give you a paper, or not even saying it verbally. And sometimes he said, so do not panic if you have no comment about the examination. Just assume that examination is normal. And let me reassure you, as regard examination, most likely you will know the diagnosis from history, most likely. So examination usually is a show. You are just showing your skills, because you know for sure that this is a normal person. He doesn't have a murmur in his heart. He doesn't have a skin finding that you will look when you uncover his abdomen. He doesn't have splenomegaly or hepatomegaly. He's normal patient. So just you are an actor, and you have to be a good actor as regards examination to show that you are competent in your skills. In Dubai and Cyprus, as I said before, only say what you want to examine. Full performance is not required. They will just give you a paper of the finding. As for the last one, which is the management starts first with clarification of the diagnosis. You have to say a diagnosis or differential diagnosis, and then reassure the patient, address the eyes, the idea, concern, expectation that you asked earlier. Like, for example, patient think that he has cancer, so you have to reassure him, don't worry, it's not cancer as you think because one, two, three. And then give advice, a non-pharmacological advice, like weight reduction, like exercise, of course, if it's relevant to the case, and prescription if needed, and referral if indicated, and investigation if indicated, and when to follow up the patient, and plan and safety netting, which means that if things did not go as planned, when this patient should come back to you earlier before his next follow-up, or when he should go to the emergency department. This is called plan and safety netting. And this is the initials of this so that you can reminder CRAPRIOPS, CRAPRIOPS, or anything that can remind you of this. Those items very important to be covered in the management. See, those items, if you started the management only 1 minute before the whistle or the end of the 10 minutes, you will not be able to say all of them. So it's very important to start management early to have a good time management. This comes by more practice and practice. So are all those mandatory? No, not all of them. The mandatory in all cases, clarification of diagnosis, addressing eyes, and non-pharmacological follow-up and safety netting, but not all cases need prescription, not all cases need refer, not all cases need investigation. And safety netting, only one exception that you will not give in admission cases. Safety netting means that if you have chest pain at rest, please call the ambulance immediately. This is safety netting. Patient is going home when he should come back immediately, or go to emergency in case things did not go as planned. But in admission, if patient is already admitted to the hospital, you will not tell him, if you have chest pain at home, come back. He's already in the hospital, so you cannot just say this safety netting in admission cases. So this is the consultation, or we can say consultation skeleton or exam format, how you should perform in this, or what you are expected to do in this exam. This is where you are examined. This is South Asia. South Asia picture. These are the rooms, just to be familiar with the environment over here. Those are the rooms, 1, 2, 3, 4, 5. All of them are rooms, and you can see the door over here. There are papers outside the room. Paper. Once you go out, you go to the next station and see the paper. And sometimes you are diverted to this table. This table is a break station or rest station. This is number 19, rest. And here you can find candy. You will find it only at the beginning. And after this, this one will disappear. All of the candies will finish, and all the tissues will be finished also because of crying. Of course, I'm kidding. Hopefully, nobody will cry, inshallah. You may cry of joy, hopefully. But the point is that really the candy finish early, so you may take the first break, try to take some candies, or have a reserve with you. And by the way, you can have your own coffee, but you can take permission, like a coffee mug, you can take permission to keep it with you, especially for a caffeine-aholic like me. This is the room inside. If you come here, you can find this is a table. The patient will sit here and you will sit here. There is a pen and a paper in front of you if you want to write anything. And this brings me whether we should write or not. Can anyone remind me to answer this at the end? Should we write or not? I will answer it at the end because it's a long answer. I don't want to interrupt the flow of explaining. This is the bed. You can see this is not a medical bed. This is a hotel bed. So if you want to give a 45-degree for the patient, you need to put a pillow. You need to put a pillow. You cannot invert it. Like, this is not a hospital bed or a medical bed. It's a hotel bed. So if you need a 45-degree angle for like venous pulse examination, you need to put the pillow 45-degree. Simple as this. And here the examiner will sit. One examiner, usually once you come in, you will give him your card. I will show you the card next. And you will go to sit with the patient and talk to him. The examiner is watching you, so you just ignore the examiner completely. This is tissue for a Breaking Bad news case, and alcohol to clean your hands, sanitize your hand before or after. Those are the tools. Usually the tools are present in all cases. So do not just assume once you come in, there is a hammer, then I must use it. No, not necessarily. You may find the hammer and otoscope in a case that examination is not required. Do not assume that since they are here, I must do them. Okay, those are also gloves. And bringing gloves, sometimes they are bringing the plastic gloves, not the latex gloves. So I'm not sure about after COVID pandemic is over, alhamdulillah. I'm not sure they are still sticking to this or not, because these plastic gloves are very much disturbing. And talking about examiners, there are two chairs. Sometimes in some stations you may find another examiner. The other examiner is external examiner, usually from UK. Sometimes you will find him wandering in different cases, and sometimes he is sitting in always in one case. When you find two examiners in one room, most likely this room has a camera. And this external examiner, he's auditing the performance of the examiners themselves and seeing all over the performance. Anyway, my advice, ignore both of them. Ignore them completely. Just focus with the patient and consider they don't exist. Because if you focus with them and with their reaction and whether they like what you said and whether they didn't like what you said, you will completely lose concentration. So just focus and give them, consider that they do not exist, and they will not talk to you in the exam for any reason. They will never talk to you. This is their job, just to remain silent and checklist what you are doing. Okay. I was just saying that ignore the examiner completely, because the examiner is ignoring you. So you have to do the same with him. He is not talking to you at all. Okay, not talking to you, is not allowed to talk to you. You will only talk to him in case there is technical problem. There is technical problem, like for example, like there is no pillow and you need a pillow to avert the patient on bed. Or example, there is a missing tool. You need a tool to do some examination. You need to talk to him, but do not talk to the examiner like, I finish examination. Huh? Any finding? Like, I want to do TSH. Where's the paper? Do not ever do this. This is definitely inappropriate and it will be taken against you. And also don't talk after the whistle. Once the whistle is fired, just go out. Go out. Do not continue even the sentence that you are doing. Nothing will be counted for you after the whistle. This is the card of the examination. This is my exam. This is my card. I still keep it till now. So this is a card. You will keep it with you from the beginning of the exam, and you will give it to the examiner once you come into the case. And once you finish the 10 minutes, you will take it out with you and until the exam and so on. This is a paper outside the room. This is example of the paper, what's written outside the paper. So, for example, here, Mrs. Ahmed, be careful of the idioms. Mrs. Ahmed, 35 years old, come to discuss with you her lab results. So here is female, not male. And this brings funny situation that occurred to me. Because of fatigue in the exam, I read this as Mr. Ahmed. And once I come in, I was looking for the male to sit in front of him. But for my luck, the examiner was a female. So both of them were female. So once I come in, there are two females and the name outside is Ahmed. What's going on? So I just look at the paper at the table in front of the patient. So I double checked it again. It's Mrs. Ahmed. For my luck, that the examiner was not male, or otherwise I would sit in front of the examiner because I was thinking that it's male. So be careful of the idioms, okay? Also, you may find findings, vital signs like blood pressure 120/80. So don't measure it again inside. If you find temperature, for example, 39, do not ask inside to measure temperature when you start the examination. Also, there is a request, take relevant history, do management plan. Sometimes they are saying examination is not required. Sometimes they are saying examination is required. Sometimes they are leaving it for your own judgment, whether it's you need to do it or not. Of course, this depends on the situation of the case, whether examination will help you in this case or not. If it will not help you, you don't have to do it. Some more information in Dubai and Cyprus, like brief past medical history, brief drug history, brief family history. And this brings us, you remember when I told you the difficulty in time management, it's much less in Cyprus and Dubai because of this as well. The people outside save time of data gathering because you already know the drug taken by the patient, the family history, the past medical. So you have very few questions to ask in data gathering in Dubai and Cyprus. But in South Asia, usually the paper is only very shortened. Take relevant history, do management plan. You have no idea about any details from the patient, so you need to ask them inside when you go in. So Now we know about the exam. I took you in a round inside the exam room. Now, since you know the exam format, how the exam is marked, how the examiner is looking at you, how he is judging your performance. First of all, the consultation skills. The consultation skills is how you will care for the patient needs, for his welfare, how to show empathy, how to explain the condition and management to the patient. Those things we did not learn it in the applied knowledge test. And to be honest, and I think all of you agree with me, we did not learn it in the undergraduate. For my part, I did not learn it in my medical school, and most of you did not do it. So it's completely new skill that we are acquiring. Maybe some of you have mastered it from any postgraduate other qualification, or he has a talent in this, or he volunteered to teach himself in these skills. But for this exam, it's highly crucial to master it because it's very important and it gives good impression about you in the exam, and it's very new skill that we need to acquire for this exam. The second is data gathering skills, history taken, how you will take history properly and to be focused history. Counseling and examination skills. As you all know, of course, the examination skills need to be focused, not to waste time, to do the full systematic examination. And counseling is for cases in which there is no examination. You need to explain the lab results. It's more like consultation skill as well. Management and investigation skills according to the updated knowledge. So those are the four domains that you are assessed in each case. Either excellent or competent or unsatisfactory or poor for each single domain and for the case overall. The overall assessment can be either pass or borderline or fail. You may fail one of the domain and pass the others and get a borderline pass or even pass. And you may fail one or even two domains and you still can pass. And sometimes one domain only can make you fail the whole case. Like, for example, a very poor management that compromise the patient safety can make you fail the case even if you did 100% in the three first domains. For example, if you did not admit a case that need admission, if you did not admit an emergency case, then definitely you will fail the case. You failed the management and investigation skills. Even if you did very excellent consultation and data gathering and counseling, if you compromise patient safety, they will have zero tolerance with you. They will fail this case, and very likely that you will not even be able to pass the whole exam because you will get a very low score in this case. So this can affect the overall score of your whole exam. But in case there are minor mistakes, or we can say moderate mistakes, not major mistakes, that made you fail one case or two or three or four, but you did well in the rest, that you did a very good score in the rest, you can still pass overall the exam. So don't worry if you missed a case or two or three, don't worry. You still have chance to do well in the rest of the cases, and the overall score can make you survive to pass this exam. Passing rate in South Asia is 40 to 50%, and in Dubai is 55%. Cyprus, I don't have information about the passing, but I think it's more approaching to 70 up to 80%. So passing rate here means that half of the candidate or even less of the half, more than half of the candidates will not pass this exam. But this does not mean that it's impossible. You can do it. And believe me, you have the potentials to do it. Just prepare well for this exam and inshallah you will get through it. How many attempts you have? As we said before, in South Asia, you have 3 OSCE attempts or 6 years after finishing AKT, whichever sooner, and you need to finish AKT first. We mentioned that before. Dubai, 3 years, order is not needed, and you have unlimited trials. So in Dubai, for example, if you have AKT in March 2020, then you have to finish the OSCE and the MAQ within 3 years before March 2023. So even if you have more than 3 attempts of OSCE or CCSA exam, this is the difference between South Asia and Dubai. And Cyprus unspecified duration, and the exam is once yearly. Brunei Center, by the way, is closed since 2019, and all who finish the AKT exam of Brunei are transferred to South Asia Center to continue, and all the rules of South Asia applies to Brunei, so they should finish OSCE within 6 years of AKT. So the last batch, I think, of AKT was 2019. The last chance to get through OSCE is 2025. The examination fees of South Asia is 620 pounds sterling. That's around 740 US dollars. And there are 3 venues, Karachi and in Pakistan and Chennai in India. This is new center just opened this year, and Colombo in Sri Lanka. Usually Karachi in March and Colombo in September or October, and Chennai this year has been in July. We are expecting that it will be repeated next year, inshallah, because very high demand on OSCE. So hopefully, inshallah, the center of Chennai will be permanent center, especially for our colleagues who are Indian who have difficulty to acquire visa for Karachi. They have to wait each year for Colombo to appear. So Chennai will be a very good chance for them to appear in their home country. And as for Dubai, around 1,430 US dollars or 5,250 Arabic dirham. Costs are not including the travel cost, the visa cost, and the hotel cost. And this as for the 2023 exam. The Cyprus exam is one package for all exams, which is very expensive, 12,000 euros, 14,200 US dollars, including the family medicine master, plus I think the diploma. The master, you have to pay more, also with the MRCGP exams. So we know now about OSCE exam, how to prepare for OSCE exam. All of you have mastered the knowledge in applied knowledge test. I think most of you have used sources like past medicine for preparation of OSCE exam, but for AKT exam, but let me tell you that the story is different in OSCE or CSA exam. Books alone are never enough for OSCE. They are only aids, and the main cornerstone for preparation is practice. Practice, practice, practice. The 3 corners for OSCE exam, if I summarize OSCE preparation into 3 parts, they are understand how to practice, source of knowledge that is OSCE or CSA based or OSCE format, and practice. The 3 main pillars for preparation of OSCE exam. Now let's take them one by one. First, understand how to practice, because if you started practicing from the beginning while you are practicing wrongfully, you are wasting your time. So it's very important to understand. You need to know how to do it in the right way. And when you know how to do it in the right way, you have to do more and more and more so that these skills become very spontaneous, that you can do it easily in the exam in the middle of anxiety and the tiredness and all the situation, the pressure in the exam. If you did not master the skills that you already understand how to do it correctly, by more and more practice, you will not be able to perform it well in the exam. So first, understand how to practice. You have 2 options: either to surf the internet on your own or use orientation course. Understand how to practice, understand how to ask questions, how to do counseling, how to do the consultation, how to do empathy, how to ask about eyes, how all the consultation skeleton that we have discussed, how to master them, how to address them, how to ask them, many different aspects. You can do it on your own or you can use orientation course. The difference between them is that if you do it on your own, you have to read and watch random internet sources on your own. It takes longer time and not guaranteed to get correct materials. Nobody can validate that those sources are correct. They are the right ones. And you may find the right ones, but you may consume more time in reading, in summarizing, in getting the information that you are looking for. But as for the orientation course, if you take structure course based on the MRCGP international exam format, it will save time, it will systemize your brain, and put you on track from the beginning. So it's mainly a time saver and a validator, validating the information that you will get that from a person who is expert, who is directing you to the correct MRCGP international exam format. The second one is the source of knowledge for OSCE or CSA based exam. Where is past medicine here? It's not there, because past medicine may talk to you about a genetic syndrome of Prader-Willi syndrome, but you will not see it in OSCE exam. So you need to focus on the conditions that show up in OSCE exam and how to address them from OSCE perspective. I cannot, of course, explain it in much details. I'm just giving headlines over here in this lecture, but there are books like CSA Symptom Solver, CSA revision note for MRCGP, get through MRCGP, MRCGP CSA cases, and the guidelines like NICE guidelines or WHO guidelines. The sources should be updated and according to the most recent guidelines, because if you read a source that is outdated, like CSA Symptom Solver, the latest version is 2014. Until now, no other version after that. I think they're no longer producing updated versions. So you may find very outdated information in those books. And online guidelines like NICE and WHO are important, but the digging into those guidelines is very much time consuming. So if you found a summary for those guidelines that is updated and give you concise information, that will be much time saving. The third one, we already know, understand how to practice, and then source of knowledge, that's OSCE format. And the third one is practicing. Practice is the most important, and guess what? It's the most neglected by most of the colleagues, unfortunately. You should practice enough and correctly. Correctly by knowing how to practice correctly, and enough by practicing many cases. Missing any of those two, enough and correctly, or both of them, is the main reason why candidates fail in OSCE CSA exam. Practice is actually 50% of the exam preparation. I know it's a big percentage, but believe me, it's absolutely true. 50% of your preparation should be practice. So if one colleague went through this exam by reading books only, he is going with a 50% chance to pass. There are three forms of practice for this exam. You have three options: either to practice online or practice physical simulated, means that with a study partner that you meet with your colleague either at your home or at his home or at like a hospital or in a public place. Physical, but both of you are not patients, so it's simulated. Or physical in clinic. You are doing your job as a doctor, and the patient is a true patient. He's actual patient. So you have three options here. I think those are the three possible scenarios for us, either online or physical or simulated or physical in the clinic. Let's take them one by one. The online, it has advantages and disadvantages. The advantages of online, it's very easy to arrange sessions. You can just text your colleague in WhatsApp, let's go Zoom, let's go. Just 5 minutes and both of you can go Zoom and finish one or two or three cases. And better time management, of course, because time management here is either too easy to arrange. It's good time management, because when we took the other two parts, it's difficult time management. I will get to them. But here also another thing regarding the online, that there is a time lag in the online sessions. Time lag seconds, around seconds. In 10 minutes, you may find 5 minutes or 5 seconds lag, or up to 10 seconds lag time. This lag time is because of the delay of sound that travels from you to your colleague and the opposite. This time lag, if you practice online a lot, and then you go for the real exam, you'll find that the cases are finishing faster than you practice. They are finishing fast because actually the online is there's a time lag that help you to practice to save in the real exam or the physical exam. You will save 5 seconds up to 20 seconds in each 10 minutes. And also easier to find study partner, because some of us, they may have difficulty to find a colleague who is appearing in the next exam of MRCGP in the same city. But online, you can do cases while your study partner is in another country, no problem. And also flexible to unstable duties. If your stable duty is unstable, you and your colleague, you can easily arrange a 10 minutes or 20 minutes or 1 hour that is common between both of you that you can study with. And also, of course, English training, because both of you are speaking English. And the good news here that one shot case scenarios in the course adopt the tools and environment. I give you the tools and environment to practice online or practice physical, the anything you want. So this can help you in case you, because some of the ready-made scenarios that available in some books of MRCGP, they don't adopt the environment of online practicing. But here in one-shot case scenarios, I developed this to be feasible. The disadvantages of online practice is difficult to assess the body language, because some of you may practice without a camera, but this can be overridden by practicing with camera. So you can observe the body language, you and your friend as well. You can observe it for your colleague and your colleague can observe it for you. The second disadvantage is difficult to assess the clinical examination, because in online, you cannot do a clinical examination to your colleague. However, this can be overridden by performing examination on family member. Like, for example, if the examination is required in a case you are practicing online, you can skip the examination time. The allocated examination time is estimated to be, for example, 2 minutes, and finish the case in 8 minutes. And then after the case finish, you start to do examination to your family member, or gather all the examination and do it to a family member. The family member doesn't have to be a doctor, because he just following your commands. Can you sit here? Can you lie down? Can you take off your shirt? No need to be a doctor, no need to know the scenario of the case. And also, you have another option to discuss it online. Like you discuss it, especially for people of Dubai and Cyprus, they can discuss what they want to do. But as for South Asia, you need to practice to do it hands-on on a person, which is not feasible in online. So you can do it instead in a family member. This is an online practice. The physical simulated, the advantages of physical simulated is that very much similar to the exam environment. You can apply clinical examination unlike the online. And English training, because your colleague who is practicing with you know how to speak English, and he's doing the role of a patient who is speaking English. And body language training, unlike online, if you're not using the camera, here very much you can assess the body language. The body language, sorry if I did not explain it to all of you, the body language means that how you will respond to the patient non-verbally, actively listening, eye contact, smiling comfortably. Those are the body language is discussed in details in the course. The body language training is very important to assess, because it's assessed in the exam, is part of the consultation skills. And it's very good in the physical simulated to be assessed. And this physical simulated is a perfect solution for people who have a spouse, a husband or a wife, who can speak English and ready on demand. They are staying with you at home. They are available all the time to practice with them. This will be the perfect solution for those who are lucky to have a spouse who can speak English, who is available to practice as much cases as possible. The disadvantage is that some of us don't have this perfect spouse. So in this case, difficult to arrange meetings, difficult to find study partner at the same city, difficult to practice many cases, because even if you arranged a meeting to sit together in the same city, you could have difficulty to find common time to practice as much cases as you can. As all of us or most of us are employed, so you may have different time of duties, may have different cities. We are living in different cities, maybe living in the same city, but long distance of driving to reach. So this can be difficult to arrange meetings to practice as much cases as possible of the physical simulator. The final one is physical in the clinic. Physical in the clinic, the advantage is that clinical examination can be done. Physical in clinic is you are a doctor and you are seeing patients. You are in clinical clinic or clinical specialty, GP or family medicine, and you are seeing the patients and taking history, examination, and management. Body language training, of course, and more realistic cases and challenging cases. Sometimes they are very challenging, and sometimes they are teaching you to deal with the unknown diagnosis, which is very important thing to learn for the exam. So physical in clinic means that you are a doctor in a daily practice clinic, and the patient is coming. He's true patient. He may have he definitely have a complaint, and you are counseling him, taking history, examination, and this can help you to do the clinical examination. Can be done. Body language training and more realistic and challenging, especially dealing with unknown diagnosis, which is very important to know how to do that in the exam. The disadvantage is that cannot be done by everyone. Not all of us are in daily practice. We have a clinic. Some of us are doing like ER. We are not a family medicine specialty or subspecialty or paramedicine or unemployed. So not all of us have this chance. Difficult to do 10-minute practice. We cannot stick to the time management of 10 minutes in those real life cases. Sometimes take longer. Sometimes you have to do it shorter because of crowdedness. Uncommon English practice. Not all of us are dealing with English speaking patients. Patients are not speaking English. Not all of us have this chance and cannot choose the cases. Like, for example, I want to practice in common cases in MRCGP. You cannot choose your patients. Sometimes the patients have different other diagnoses. Sometimes they are coming only for refill of medication. So this is not a common case for MRCGP exam. And the paperwork interruption, like the electronic documentation or writing prescription, those are time consuming and interruptions. So this can be confusing as regard preparation for the exam. So if you ask me, which one is the best? I would say practice all the three if you can. If you cannot, then do as much as you can in the online, because the online, if you can see, it's the only one that you can override the disadvantages. You can override the disadvantages only in online. But if you have disadvantages in physical simulated, in physical clinic, you cannot override them. If you have one of those disadvantages, you cannot avoid it. But the best thing is that do as much as you can. Do practice as much as you can. If you have a chance for physical simulated, do it. If you have a chance for physical in clinic, do it. And do not spare any effort to practice as much as you can in the online. Of course, those who have the spouse, they can let go of the online. Those are the only exception. Those who have a spouse who is fully dedicated to practice as much as they can let go of online, because definitely this wins the preferred than the online, in case there is a family member who is fully available to practice as much cases as can and can speak English. And by the way, the one-shot case scenarios, they are applicable for the patient to do the rule even if he's not medical. So this is a good news for those people. So now we know how to practice or how to prepare for this exam. If we summarize in 5 words, why candidates fail in OSCE? I've said that before. It's only one slide. Lack of sufficient correct practice. Some colleagues practice correctly, but insufficiently. And some colleagues practice hundreds of cases, but incorrectly. And some, they don't do either. They do not practice neither sufficiently or correctly. So this, what we can say, is the main reason why candidates fail in OSCE exam. Now comes for the one-shot course. How can one-shot courses provide, or what can they provide to you for this exam preparation? We know now that we have three main pillars for preparation of OSCE exam. How can this course help you? The OSCE exam cover the three domain for one-shot exam. MRCGP OSCE orientation course cover all the three domains for preparation, understand how to practice, source of knowledge for OSCE based, and practice. The first one, understand how to practice, is very well covered in section 1 videos called OSCE story. From A to Z, completely details that to understand how to practice. And then I applied this in 3 cases of workshop. So OSCE section 1 contains all what you need to know how to practice, and 3 interactive workshops to know how to practice using one-shot case scenarios that we'll get to it later, and how you evaluate your performance using the scored marking sheet. And we'll get later to the scored marking sheet. But the workshop is, of course, since I'm speaking now, the course is fully recorded for those appearing in next November exam. It will be repeated live, inshallah, in January 2024. But before this, all the content is fully recorded, including the workshop. But guess what? You can participate in the workshop even if it's recorded, because there are questions that you need to answer. You will hold the video, the recorded video, you will stop, you will pause it, and answer with me. And then you will listen to the discussion and see whether you answered correctly or not. So the workshop, you can participate to it even if it's recorded. The second one is source of knowledge for OSCE CSA exam based. It's well covered in section 2, 200 A to Z cases, 200 cases in section 2, and section 3 contain 100 case. So all of them are 300 topics that are common in family medicine and MRCGP exam are covered in section 2 and section 3, covered in the OSCE CSA format, the same consultation skeleton that we mentioned before, the history and examination and management, the focused history, the focused examination, and the management that is relevant to this particular case. All of them are full covered in section 2 and section 3. Revision course also available for section 2. The last week revision, help for the last week revision, called revision to the point. The section 2 topics, the 200, are very summarized in revision videos, to the point, very shortened. I think around 10.5 hours only, you will get through 200 topic of section 2. And the ebook, the smart ebook, it's contain index that contain also drug index and direct link to the videos that's connected to the video, so that you can just click on one button. It will take you to the lecture video or the examination video, and you can read the case handout. So you have audio or video, PowerPoint, and after that you can review or revise through the handout. Those are the references for preparation of the content of the course. All these are source of knowledge. Get through CSA Symptom Solver, Oxford GP, even Past Medicine. I took it as a source, reliable source, up to date, BMJ Best Practice, NHS, CKS, GP Notebook, Patient.com, RCGP platform. All of them, I took flower from each garden, as they say, all of them gathered in one single source. So I saved for you time to go through all these references to get the information. I put it for you in only single source. The third part is the practice. I help you in practicing for this exam by 8 different ways, because practice is the most important. So I have 8 different ways for practice. Number 1 is section 2, and the workshop contains clear pathway to practice. So even in section 2, I've given you hints and the advice about things to tackle in practice and how to get through it. And also the first part of section 2, how to practice. Section 2 has two parts, part A, part B. Part A is strategy for preparations to take up your mind. This is very important part because it tells you how to practice with your colleagues. And the second part is the 200 topics that I mentioned them earlier. Number 2 is focused examination videos for the common MRCGP international cases in which examination is required. Out of the 300 cases, 80 cases are common to have examination required, because not all cases examination is required. Like pedia cases, they don't have examination. But and this brings, by the way, that in pedia, you will not see pedia cases in MRCGP exam. You will only see a mother discussing her child problem. You will not see a pedia case. You will not see a child 2 years old or 5 years old. You will not examine. So examination is not required in all pedia cases. They will only show you a photo. So here we are talking about 80 common cases, like musculoskeletal cases, like cardiovascular, like respiratory, like GIT. Those have two parts. Those 80 cases have two parts: performance video and explanation video. Performance video, that I'm doing the examination exactly as if I am in the exam. So I'm talking to a patient. I'm not talking to the examiner. I'm not talking to anyone. I'm not explaining what I'm doing. I'm just doing it, and with a stopwatch to show you how much time it took from me. And in all the examination, I took less than 3 minutes, as we said before. And in the explanation, it's a separate video. I'm explaining what I have done in the performance, so that you can understand. And this can help you also to understand and digest why we are doing those steps, what's the rationale. But definitely we will not say this in the exam, but for you to understand, to be convinced about those points. And also those videos, those examination videos are highlighted with examination point summary slides. Those summary slides remind you for the steps. So you watch the video, and then for the revision before the exam, you have it written as written steps, like palpate the abdomen, palpate the liver, palpate spleen, auscultate the abdomen, temperature, blood pressure, and so on. And there are points which are VIP steps. They are highlighted in red. So if you run out of time and you need to compress the examination to be more focused, you need to stick to the VIP points at least, because they are very crucial to do them, that if you did not do them, you will definitely lose marks in the examination. The second part, number 3, is 100 written ready-made case scenarios in MRCGP International exam format to help you practice with your colleagues. These written case scenarios, it's really a very valuable tool for you to practice on your own. Those contain 20 fully performed cases as key answer. So those are written cases of a patient scenario and a doctor paper that you will see outside the room. One of your colleagues will volunteer to do the patient rule. So he will read the patient scenario, but you are not seeing this scenario. You're not allowed to see it. You are just only reading the doctor scenario. And he will do the rule of the patient. And after finishing the scenario, you can do evaluation for yourself by the scored marking sheet for all the cases. So it starts like this. One will do the role of a patient, and one will do the role of a doctor, and the scenario adopt the tools and environment for online practice, as we said before. And scenarios are divided into easy, moderate, hard, so that you can start first by easy cases, and then moderate case, and then hard cases to escalate your progress. And there are cards that you can open, the same like the exam, exactly like the exam. And the patient will tell you, the one who is doing the role of the patient will tell you to open them in case you ask for them. And after finishing the case, you can mark your performance with the artificial intelligent automated scored marking sheet, so that you can use examiner at home. We can say it, I will use this term in Arabic. يعني انت خدت معاك examiner في البيت عندك. مش محتاج انت تقدر تقيم نفسك. You will evaluate your own performance. Once you finish the case, you have scored marking sheet for this particular case. Each case has its own scored sheet that's different than the other. You just click what you did, what you didn't do. Like for example, you ask about red flags 1, 2, 3, yes or no. If you write yes, you will get mark. If you write no, you will lose mark. And at the end, you will receive a final score for this, like this exactly. So, for example, here you can find a score for each particular domain. Like here, this candidate failed in consultation counseling domain, 68%, and failed also in data gathering, 20%, but he yet get a clear pass in management and investigation, 94%. He was excellent. So overall, despite he failed in consultation and data gathering, he managed to very barely pass the case, marginal passes overall for this case, because he did well in management. So that's what I said before. You may fail in 1 or 2 domain, but get an overall clear pass, marginal pass of the case. This automated scoring marking sheet, I made it for each single case of the 100 case, and it's exclusively innovated by me based on evidence-based mini kicks principles. And let me clarify something very important. It's not related at all to the official exam scoring, because anyone may ask whether how the exam is marked, what's the sheet of the examiner, of the true exam. Nobody knows. Nobody knows. It's completely confidential, and I don't know it personally, but I give you evaluation scoring that is based on evidence-based, something called mini KICS examination or mini clinical evaluation exercise. This is evidence-based training for healthcare providers or clinicians, and I adopted this tool to give you this scored marking sheet. So if you master this or use this as a true reflection of your own performance, believe me, once you do this very well, or you do good in this scoring, I promise you, inshallah, you will do the same in the true exam, because the true exam is not physics. It's not physics, it's the same. The same. We are all talking about the same principles. So if you practice here in this 100 case, which evaluate each one has scored marking sheet over 50 points in 4 major domains of the OSCE case, the one we mentioned before, it applies principle of Minikix. You will receive score of each domain and overall score of your performance calculated automatically. So all what you need to do manually is to tick what you did, what you didn't do. And eventually, based upon your choices, you will get a score overall and for each domain, so that you can identify your weak points. I'm just giving you a magnifying glass to identify your weak points and work on it. And if you feel anxious that you cannot use this scored marking sheet, I teach you to use it in the workshop. This is the purpose of the workshop. 3 cases of true mock exams done with candidates, and those 3 candidates, all of them passed, alhamdulillah, immediately after this mock exam. All the 3 passed, and I'm proud to teach them, the same as I'm proud to be your teacher as well. In this workshop, all of us, we solved, or we did the role of the examiner for the 3 colleagues. And after finishing the workshop, you will be very confident to use the scored marking sheet for your own performance. And you can, as I said, participate in workshop even if recorded, and you will feel confident to use the scored marking sheet afterwards. Number 5, on assisting you how to practice the recorded case scenarios. Recorded case scenarios is recorded mock exams for the same 100 cases that it's available as written cases. They were done by candidates, and I recorded their performance, and I given their feedback. So you have almost over 250 fully performed recorded cases with their detailed audio constructive feedback. So it's like this 10 minutes case, and then I comment audio about the performance, but in very much detail. Sometimes I take more than 30 minutes only commenting about the feedback, the performance of the candidate, audio constructive feedback with overall score. I'm using the automated scoring sheet and giving a final score of didn't pass, marginal pass, clear pass. And in these recorded cases, you have a list of those who passed, those who didn't pass. And some cases are done by more than one colleague. That's why they are 250, not 100. Like, for example, case number 39, it's done by one candidate who did a clear pass and another candidate who get a clear fail. So you can listen to both of them to know why this guy passed and why this guy failed, although it's the same case. And also, I'm providing summary reports for common pitfalls in all the 250. There are four or I think five summary reports for those who cannot listen to all the 250. You can listen to the summary reports. And also, there is merged audio feedback. My audio feedback is all merged in a long audio for people who wants to listen to it only, and all available for offline download. All the content of this course is available for offline download to watch without internet. Number 6, 25 quick audio tapes for things called do's and don'ts. Do's means things you should do. Don'ts means things you should not do or do not do it in the exam. Those are 25 quick audio tips for unsuccessful candidates. In South Asia and in Dubai, you are receiving a report in case you did not pass a OSCE exam. It's called feedback to unsuccessful candidates. They are commenting about points to improve in your performance. I summarize all the 25 points, the points that they are receiving in their emails. I give quick advice for each single one. So in case you are listening to me, you had previous unsuccessful attempt, you can go for this do's and don'ts and check your email, the one sent to you, and listen to the audio items that related to your own feedback that can help you. Also, continuous communication and support. I can help you for this, that I can help you with tips, guidance, advice, support, assistance, help, also broadcast messaging. All the members of the course, they are enrolled in broadcast message that I'm giving you any critical update about anything you are instantly receiving. And also I'm helping you by finding a study partner. If you want a study partner, online study partner or physical study partner, you can fill a form and I can find a match for you. For example, if you are living in a city like Dubai and you have a duty that you are available, for example, weekend is Saturday and Sunday, I found another colleague who is appearing in the same exam as you and he lives in Dubai and he has the same hours, working hours, the same as you. I can attach you to each other. And if I couldn't find someone who lives in Dubai, I can at least find someone who has the same working hours, the same as you, so that all of you can practice. I can encourage you all to practice. So 24/7 WhatsApp support, broadcast messages, special broadcasts for revision before the exam, before the revision. I'm gathering all those appearing the next exam and suggesting how to use the next critical 18 days before the exam. And also, there are extra courses on demands and availability to help you practicing the mini mock exam and mock exam and solo extensive practice course. Currently they are not available, but once they are opened, I will definitely share this with you to let you know. Also, examiner's audit service is available. Alhamdulillah, we are proud since 2018. Over 300 colleagues passed OSCE exam with us. And inshallah, you are the next one. And Alhamdulillah, not only they received the MRCGP certificate, but they also received the one-shot course completion certificate. Alhamdulillah, this is new. I just gave it to all my colleagues just recently. Certificate of completion, you will receive it in case you subscribe to the course and finish MRCGP. you can receive this certificate and you can use it as to put it in your CV. That is that you fulfilled fundamental of family medicine in a very extensive course that equal to 64 hours of continuous medical education, and it's a verifiable certificate. And those who are top scholars, they are receiving a special format of a beautiful certificate. This is Dr. Ola, the top scorer. She was in, alhamdulillah, in our course. Her photo is currently now in the MRCGP International AG because she passed in March 2023. Her picture will stay in the website until the new one will pass in July. The top scorers are receiving a special certificate. Inshallah, hopefully all of you will receive this one, inshallah. So now the next one is the course fees. I'm sorry, I know it's a long lecture, almost finished. As for the course fees for you can subscribe either to the limited individual subscription for any of the domains that I mentioned earlier, or the whole full package of the course, or something called last minute subscription. It means that open before the last month of the exam. This last minute subscription opens only before the 1 month, 30 days of the official next exam. It's called last minute subscription. So the limited subscription fees are as follows. It depends on each particular domain. Access to knowledge lecture, videos, plus revision lecture, plus ebook, plus workshop, plus handout for 1 year. That's $150. So all those four, workshop, ebook, revision, and the section 1, 2, 3 is for $150. But after 1 year finish, you'll have to pay another $150. The other domain is examination videos. Some colleagues may say, I want only examination videos. So this is an option, $100 for 1 year. And then also extension will have to pay another one. After 1 year, have to pay the same fees again. And the case scenarios, $100, the same also. Recorded case scenarios, $100. And the last month subscription is access to all the content for 1 month only, for 30 days only, is for $150. And this only opens before the 30 days of the next official exam. And the full package is with a discount. All those packages is for $270. So that's 38% discount. Not only this, but also when 1 year finish, you will extend with only $5. Unlike the individual domain, you'll have to pay the same fees again. Here, you can pay only $5 to extend beyond 1 year. If you want to extend till, if you, for any reason you could not finish the OSCE exam within 1 year, and you need to extend till the next exam or till 6 months, for example, you can extend by only $5, and you can re-extend by $5 again and again and again, unlimited times until you pass your OSCE exam. And also the full package has free invitation to join any future repetition of the course. Like, for example, those who are appearing next March exam, they can attend with us the live lectures of 2024, totally free of charges, and have free access to do's and don'ts. This is do's and don'ts are only available for the full package offer. So this is a brief about the MRCGP, one-shot MRCGP OSCE orientation course fees. Now, how to apply for the MRCGP OSCE CSA exam. As for Cyprus, email the Nicosia College. They will give you the details. You should be eligible for CSA exam by finishing AKT and first part of diploma. As for Dubai, if you want to do the CSA exam as first exam, once registration dates come, by the way, there's a new website for the MRCGP Dubai. You can just Google it, just write MRCGP Dubai, you will find it. And still not yet the autumn dates of October, still not yet opened. Those are the requirements: photo of current certificate registration, photo of passport photocopy, qualification photocopy, 2 photographs endorsed by senior member, copy of documentation, evidence of eligibility, completed valid certificate of CPR or BLS. After application approval, you will be directed for the payment. As for South Asia, Once registration opens, which will open in 1st of August this year, 2023, of the next November exam, once the website opens for registration, you have to download the application of the exam that you will apply for. For example, next November exam, you have to download the application of November exam, which only opens at 1st of August. You cannot use old application. You have to download it and print it and fill it by handwriting and attach all the required documents, which are copy of valid medical license, whether you are working or not. Valid medical license means like Saudi Council license or DHA license, اللي هي مزاولة المهنة، رخصة مزاولة المهنة. Those who are not currently working, they can have a graduation license, I think, to practice, like Sudani license to practice in Sudan, and also in Egypt, the syndicate license to practice or language license to practice. They are not focusing very much whether it's expired or not. So even if it's expired, just send it. They will accept it. Part 1 passing email, you have to print it and send it as a hard copy. Bank draft of 620 Great Britain pound or pound sterling in favor of MRCGP International South Asia, or equivalent in US dollar, I think 70 plus, we said it before. And or you can send telegraphic transfer receipt. You have two options, and all this will be available. The details of the telegraphic transfer will be available in once the application opens. And also passport size photo need to be sent. All those should be sent to as hard copy to this address, and you need to send it very early, the first day of application, because very limited slots for the exam that usually fill quickly. And by the way, when you fill the application form, you will be asked to choose days. You will have they will ask you to choose day 1, day 2, first wish and second wish and third wish, because they will fit you in one of the days. For example, if the exam is 5 days, 11 and 12 and 13 or 14 or 15, for example, you have to choose 3 wishes. The first wish is, for example, I want 11. If 11 is not feasible, make it 12. If not feasible, make it 15. So you have to give 3 wishes so that they can try to accommodate the first wish. If they couldn't, they will move to the second. If they couldn't, they will move to the third wish. And sometimes they may not be able to grant any of the 3 wishes. They may have to put you in 4th wish that you did not choose. It depends on the arrangement. Final question, or final part of our lecture before the questions: how much time do I need for OSCE CSA exam preparation? This question is very frequently asked to me, and all of us ask ourselves this question, that especially that we have next exam is November, and now this lecture is in 1st of July or early of July. Let me tell you one thing. First of all, Sri Lanka exam or Colombo exam usually used to be held in late September and early October. So this is almost the first time, I think, as far as I remember, to be November. So you are very lucky that you have almost 3 months or more, 4 months or more until November. So this is a long time for people to prepare for November exam if they can manage their time very well. So answering this question, it depends on your own individual circumstances. It's not uniform answer that fits everyone, but the average is 3 to 6 months. Better to be well prepared than poorly prepared. This is the general rule for OSCE exam. Be well prepared. If you're not well prepared, do not go through this exam, because this exam is very expensive. It's time consuming. It's expensive as regards the cost, as regards the travel, as regards the vacation, as regards everything. So make it a single one-shot trial, okay? Practice is the key word for your preparation. There are multiple schedules in my website in the course, how to use the course materials to prepare for OSCE exam. I help you in that. I prepared 4 different scenarios, 4 different schedule: 2-month schedule, 3.5-month schedule, 6.5-month schedule, 18-day schedule. Some of you listening to me right now, they have personal circumstances, they will not be able to appear in next November. So they may find the 6.5 months schedule is much better. Some of you, they have to go through November exam, so they may find 3.5 months is okay. Some of you cannot study now at all, and they will not be able to start studying before next September. So they will have only 2 months remaining till the exam. So they can find this 2 months useful. Some of you, but I don't think they are listening, they are not attending this lecture now. They may appear in July. So they have only 18 days or even less for the next exam. So they may use the 18 days schedule. So it depends how much available time daily for studying. Like, for example, the 2.5 hour daily, you can finish in 3.5 months full preparation for the exam, including practice. This schedule, I put even practice, I put assigned time for it. If you will study 5 hours daily, you can finish in 2 months. And you can even make your own schedule. If those are not applicable for you, you can make your own schedule. I put time for each task because allocated time for each task, and you are the one to distribute them. For example, if your duty is like you are working 2 days, 48 hours, and then the whole week is free, so you can 2 days you will study nothing, and in the rest of the week you can study 10 hours. So you can make your schedule like this. It's not like fixed time each day. So it's up to you to make your own schedule as well. You can review the website for this schedule, and there is video to understand how to use the study schedule. I advise to watch it as well. And you can apply for study partner matching in the same exam. Not only this, you can also choose 4 different plans of preparation. I explain them in details in section 2, part A, strategy for preparation. You can choose either full preparation or shortened preparation or crash preparation or last minute preparation. The full preparation is the one that involving those schedules. So when I say here 2 months, I'm saying literally that he will use all the materials of the course and finish in 2 months. Or also 3.5 months the same, 6.5 months the same. So this is a full preparation plan. But some may say like, I don't want to go through all the materials, I will skip some of them. So I suggested for them the shortened plan or the crash plan or the last minute plan. And definitely from the name, it makes sense that they are less time consuming plans. So I'm giving you all the options, I'm giving you all the tools, and it's up to you to decide. Finally, you proved how excellent you are in AKT. You can get through this exam as well. It's not impossible. It's not easy, but it can be done. Just do it the right way. The 2 keys to pass this exam is to know how to practice correctly, know the game rules, and then practice as much as you can. For more information, I will write more detailed orientation about the course, a 22 minutes video. I will put it in the comments in this video. This video will upload it in YouTube, inshallah. And also mock case done by candidate to see this candidate passed the June 2022 exam right after this mock exam. And also information about MRCGP International overall. I will leave the links for you to watch it. And those are the channels for communication. You can contact me anytime. I can help you with any of the information. And finally, we will open the floor for questions and answers. The doctor said, please explain South Asia attempts more, 3 attempts in 6 years. I will say it again in English and in Arabic. Once you pass AKT, they will start counting 6 years. You have the chance to finish OSCE within those 6 years, and you have maximum 3 attempts to pass. So, for example, if you finish AKT this year, May 2023. So let's count 6 years. May 24, May 25, May 26, May 27, May 28, May 29. You need to finish OSCE before May 29. So the last attempt to finish OSCE is March exam of 29. 2029 March exam. This is the last chance for you to finish OSCE exam, even if you never had any attempt. You have to finish before March 2029. Okay, what if you have attempt, for example, in November 2023 and did not pass, and then and then March 2024 did not pass? You have only single attempt to go to pass, whether it's the next one in the same year or after 2 years or after 3 years or after 6 years. You have only single attempt regardless of when you will do it. Get it؟ هعيدها بقى بالعربي. انت من الاول. Okay, I hope this answer your question. Uh, is there any source for information like post medicine for part 2 exam? Dr. Roba, I think I answered this already. Yes, I mean, like CSA symptom solver, get through MRCGP. I mentioned all the sources and I told you all the sources, I put them in single source this course. Inshallah, you will not need any other source for it. Some of you think that the course is one of the sources that we need also to read other books. If you think that you will read other books with this course, then you will waste your time. Honestly, you will waste your time. You can ask all the colleagues who passed before. Our course is enough for source of knowledge, enough source of practice, enough for orientation, enough for everything, inshallah. Is there examination cases for joint or CNS? Yes, because it takes long time. Yes, it takes long time, but the good news, alhamdulillah, that you have the one-shot focus clinical examination videos. It teaches you how to do them in less than 3 minutes or 3.5 minutes. By the way, alhamdulillah, the focus clinical examination of one-shot MRCGP is genuine, never been done before in the internet for any of sources before. I took much time to prepare it, and I prepared it from 3 different sources. Macleod Clinical Examination, which is the recommended source in the official body of MRCGP International South Asia, and up to date, and internet sources for alternative maneuver, but not the main reference. So it's evidence-based, and at the same time, it's focus examination, the same as the examiner want in MRCGP international format. Okay, is the 100 case if I practice is enough? Wallahi, this is a good question, Dr. Ahmed. Sorry. The 100 case is, you can start with them, and after finishing the 100 case, you can make up scenarios for the rest of the 200 cases of section 2. But my recommendation, at least do section 2 cases. The 200 cases, do them all. After you finish the 100 case, you will have the skills to make up scenarios. You will have the skills to practice with your colleague and made up scenarios for the other 200 cases. And let me tell you also a good news that inshallah new cases will be added within the next couple of months. Inshallah, the rest of the 200 cases of section 2, inshallah, hopefully all of them will be uploaded in the next few months, inshallah. What about the paper in the exam? I will write on it or not? Thank you for reminding me, Dr. Arash. Thank you. Regarding the paper in the exam, you have the right to write. Just 1 second. You have the right to write anything in the exam. But my advice, do not do it. Why? Because when you write something, you are sacrificing the eye contact. So the more you are looking at the paper, you are avoiding eye contact with the patient, and this is against the consultation skills that you are required to fulfill in the exam. And because of pressure and tension and anxiety in the exam, you may look more at the paper than to the patient. And you may write lots of things that will make you not actively listening. You will write while the patient is talking, and this is a problem. This is a problem. Those who is writing while the patient is talking, you are giving impression that you are not actively listening, and you may actually not focusing You cannot focus on two things at the same time. And I want you to watch Dr. Adib in case number 2 in the workshop. He actually did that in the mock exam. He used the paper. So I want you to see, all of us, we will see in this workshop how, what's your impression about his body language. So you can refer to it. So my advice, do not use a paper and a pen, but in case you need to use it, you can use it to explain a condition. Explain a condition, draw something to explain a diagnosis, and then leave it. But to use a paper to write the items of the history, to write the items the patient is saying, you will sacrifice the body language, which is very important in the exam. I hope this answers your question. Is there any case how to handle angry patient in one shot? Yes, in section 3. How many times we need to revise one shot sections? It's enough to be once and practice it. Once you do it once and practice it, you will fix it, because practicing fixes the information. Okay, and this is the plan of preparation is very much detailed in section 2, detailed plan for preparation. I highlighted just here briefly how to do it, but in summary, some of you ask how to use the course, what to start, from where to begin. First of all, start by order. Watch the video of section 1 and then watch the video of section 2A, setting up your mind. Once you finish these two videos, 99% of the whole idea خلاص you will understand it. مجرد ما تشوف section مجرد once you finish those two important parts, you can make your plan. Make a plan and make a schedule and start applying this schedule, because this course is recorded, the course is fully recorded. You may feel lazy to start, because some of you like feel encouraged to start if they attend the live lecture. But let me tell you that having recorded cases in your hand or recorded full course in your hand is actually advantage to make your own plan, not the plan of the instructor who will decide the timing of the live lectures and whether it's appropriate for you or not, and those which you could not attend, you'll have to listen to the recording and so on. Now you can finish the whole course. You can take a vacation from your work for 2 weeks and finish the whole content of the course. You see, so this recorded can be advantage. But how to avoid making it disadvantage? Make a plan. ازاي تتجنب انك تدخل في مرحله جدا جدا بعد ما تسمع سيكشن 1 واول محاضره من سيكشن 2. Section 2A, setting up your mind. Once you listen to those two lectures, you can make a clear plan and schedule, but please stick to the schedule. The most important is to stick to the schedule. This will be the most motivator for you to finish the preparation, or to do the preparation properly. Okay, we tried to share videos in the course with Zoom, but the voice was very low. We didn't hear the dialogue between doctor and patient. Is problem just with us or any other have this? Dr. Aruba, I did not understand. What do you mean? Do you mean like the workshop? Can you clarify? By the way, the videos have a speeding option. You can speed it if you want. This can save more time. And also there are some allocated times in the schedule. You can save it. You will understand what I mean when you listen to the preparation, the section 2A lecture. And some of you may found some interruption in voices or problem in voice. This is mainly most likely due to internet problem. So if this is the case of Dr. Aroba, try to download it offline or try to make sure that your connection is okay. Prescriptions are coming in OSCE exam like TB regimen. Yes, you have to know the TB regimen. Sometimes they are asking about details. Dr. Karishma says some video voices are very low. Type, if there are some, please share it with me. Maybe there is a technical error. You are my mirror. There could be some technical errors in some video. Let me check it, please. Share it with me. Any remarks about any video with poor quality, share it with me. I will double check. I will tell you whether this is a problem at your connection, at your internet connection, or I will discover this and solve it immediately, inshallah. I promise that all technical difficulties, inshallah, can be overridden. Don't worry about this issue. Okay, معلش, some of you writing question in voice and in WhatsApp, please write it because I cannot listen to the voice now. Some colleague ask about Australia pathway. I will answer this question, although it's not the main topic of the lecture, but I will share it with you. Australia, what happened exactly in Australia? Australia, since March 2023, has recognized MRCGP International South Asia Center only to be equivalent qualification to apply for a pathway called PEP specialist pathway. This PEP specialist pathway is a pathway that can help you to get the fellowship of Australian Royal College for General Practitioner by only 6 months training and to finish their exams. The rotation of the FRCGP is a difficult application. You have to finish the AMC, the standard pathway, and then apply, and then 2 years rotation training and many exams, all this in order to get the fellowship of Royal Australian College. But they choose some qualifications, which if any of them can apply for training only for 6 months. So it's a paid job in Australia for 6 months, paid job under supervision. And once you finish those 6 months, you will do some work-based assessment, some just like CME and something like this, and then do the 3 exams. They are, by the way, easier, as I heard, easier than MRCGP exams. The same like AKT exam and also OSCE exam, the same like them, and a third exam. And once you finish all of them, you can get the fellowship of Australian College. Inshallah, just once you finish OSCE, I can help you with this. I am in contact with many of the colleagues who applied for Australia. Inshallah, when you finish your OSCE exam, they most likely their applications will be already finished, and I'm helping them also to. I provide some videos you can watch on YouTube about just instructions how to do it. But for now, focus in your OSCE exam, inshallah. Once you finish, I can guide you for this Australia pathway if you are interested to do it. Another similar question about fellowship of Royal College of General Practitioner. The fellowship, you can finish it after, you can apply for it after 5 years of membership. The fellowship benefit is, we can say, it's not in many countries, it's not, there is no difference between fellowship and membership, except one country, in Qatar. In Qatar, you have to get fellowship, and after 1 year of fellowship, you can apply for specialist family medicine in Qatar. So I can share with you, inshallah, information about FRCGP. Once I get it, inshallah, just wish for me like I already finished 5 years and I applied for FRCGP. Once, inshallah, I finish it, I will teach you how to get it, inshallah, when you finish your membership, inshallah. And by the way, our relationship and our communication, it starts with Discord but never ends. Even after you finish the membership, I still have contact with the 300 colleagues who passed. I still share with them the information about Australia, about fellowship, about even I have like CME packages, subscriptions to websites with discount. Even the Australia pathway, there is a instructor who provide the strategy call. I managed to get a discount for one shot nights, alhamdulillah, for them. So we will continue contact, and I think, in my opinion, this is the best part in this course, the communication between us. So it's not just like a subscription that you will pay for a recorded course and that's it, end of story. It's actually the beginning of story that, inshallah, it will continue. Even after finishing this membership, we will remain in contact, inshallah, and we will benefit our society by becoming better doctors, inshallah. Okay, I think that's all questions for now. One last question about Australia. Australia pathway is open for how long? No, don't worry. This decision, it will be reviewed after 5 years. This is the good news. So the decision of MRCGP Inter South Asia will be reviewed again after 5 years from now, along with the other qualifications. So don't worry, you still have 5 years to go through this Australia pathway. Don't worry. Yes, previous exams. Yes, I have a file. I can share it with you. All the previous exams in the last 8 years, I have it with me. Don't worry. How can I share video with my partner through Zoom, for example? This can be easily explained to you. Just use the share screen button. It's very easy. You can find tutorials in YouTube, and if you couldn't, I can show it to you live in Zoom at any time. Okay. كرما تشاركه معنا في جروب الواتساب. What do you mean? Share with you what exactly, Dr. A? Let me verify what do you mean, please. Okay. Okay, thank you very much for honoring me today, and I apologize for the long lecture. MashaAllah, you are very patient, MashaAllah, to to wait all this long. And inshallah, this lecture will be recorded for those who could not catch up from the beginning or those who could not attend. And I'm happy also to receive any further questions later on in the WhatsApp. Inshallah, this is my number. You can directly contact me whether or not you have subscribed to the course. I'm openly welcome for all my colleagues to answer any of your questions. Thank you very much for honoring me today and talk to you soon, inshallah. جزاكم الله خير. سبحانك اللهم